With so many different therapies available, it's difficult to choose which one is the best for you. They all claim they're helpful, they all claim that they have good research behind it, and they all claim that their modality is going to be the best fit for you. I understand if you're confused. I would be too if it were me. Actually, if I were not in this field and I had to find a therapist, I would be completely lost. Especially because there's so many therapists, not only in your town, in your area, but you have access to more therapists because there are also so many to choose from online, from all over the world. I've tried to make it easier for you to choose a therapist based on some of these questions that I think is very, very useful to ask your therapist or to research before you commit to therapy. So the first question is, what problems does this therapy treat? So does it treat couples problems? Does it specialize in OCD? Does it specialize in depression? What exactly does it specialize in? And the next question is, why does it treat these problems specifically? Is it because there's a lot of research behind it since it specializes in, let's say, treating OCD? Is it because the therapist knows something that's valuable and important to know about treatment for OCD that you can't find elsewhere? So this is an important question to ask. Next question, and one of the most important questions you can ask, is what mechanisms is it that is changed in therapy? So let's say a therapist treats your depression by going over your childhood experiences. So the assumption is talking about what happened in your childhood, all the traumatic experiences, will help you recover from depression. So your question would be, what is it that changes in the brain that makes talking about my past help me overcome my depression? Here's a disclaimer. Although psychotherapy is a huge field, unfortunately, there isn't much research. We don't know exactly what changes in the brain since we recover. So there's still a lot of research that needs to be done in that area. Therefore, it's impossible to expect your therapist to tell you a complete breakdown of exactly what cells and what neurons in the brain change from the therapy they're offering, because there's still not enough available knowledge. But what you can go for is the answer that brings you the closest to that. So does this answer make logically sense? Does going over my childhood help me recover from depression based on this explanation that they've given me? If it makes sense, then perfect, you can go ahead. Next question is there research behind this type of therapy? There are a lot of therapies who have a lot of research. So CBT, cognitive behavioral therapy, has over 50 years of research behind it. Metacognitive therapy has 30 years of research behind it. So the next question tied to that is it good quality research? So here are some tips for how to discover if these studies are good. First and foremost, who are these studies made by? Are they only made by the person who's developed the therapy? Or is it also made by independent researchers that are not directly linked to developing this type of therapy? These studies made on a lot of people, a lot of different people. So is this powered trials? Is it huge studies so that we can make some good conclusions based on those results? Or is it only small studies that didn't really measure what they were trying to measure? A therapist who really knows his or her stuff would be eager and happy to answer these questions. Next question, what is required of me if I start therapy? So if I go to therapy once a week for 45 to 50 minutes, can I expect to recover from that, or is it expected of me to do some homework? Let's say if I am dealing with anger issues and I tend to react very angrily toward my spouse or in my relationships, going to therapy expecting that 1 hour of therapy is going to change something that's been a pattern over long term. Maybe I've been doing this for months and years and maybe my whole life. I can't expect to change this pattern based on 1 hour every week. So what do I need to do? Do I need to practice on my relationships the things that I learned in therapy? How often, how much? And then you, together with your therapist, can find a good solution that fits you and your schedule and your needs. Let's say you've gone over these questions, you've got some good answers that you're happy with, and you find the logic in what you've been told. Next question is, should I commit? If you're still not sure, then what you can do is to try to commit for a certain amount of time. So most therapies need some time to work. So let's say if you're suffering from anxiety, you need to do certain things over and over for that thing to work, and you get relief from your anxiety. In order to see if this is really beneficial, if this therapy is really helpful for you, try to commit for 4 weeks. So this is what I tell my clients who are not really sure. They think it's interesting, they would like to learn more, but at the same time, they're afraid maybe to let go of their overthinking. So I recommend that they come in and they give it their all for 4 weeks. Based on these 4 weeks, they can then decide if this is really something for them and should they commit more long term. I'm a metacognitive therapist. I specialize in metacognitive therapy, and this is the only type of therapy that I do. I'm fully committed to this method because by far this is the best thing that I've tried and I think works the best for my clients. So I'd like to answer these questions based on metacognitive therapy. So first question, what problems does this therapy treat? Metacognitive therapy treats anxiety, depression, OCD, and PTSD. And there's a lot of research behind this that is proven to be very effective. Metacognitive therapy also seems to work on people with borderline personality disorder and people who suffer from psychosis. Why does metacognitive therapy treat these disorders specifically? According to metacognitive therapy, anxiety, depression, and OCD and PTSD have in common that there's a lot of overthinking involved. So overthinking in the form of worrying and ruminating. People who suffer from these disorders worry and ruminate a lot. And worrying and ruminating make their symptoms worse and cause and maintain their disorders. So a simple way to explain this is that you've cut yourself and you got a wound. And that wound needs to heal. So your body is able to heal that wound for you. This is a regulatory mechanism that we have. If we give it some rest, then the body will take care of that, and a few days later, the wound will be healed. But if we go on and scratch the wound and continue to look at it and do something about it, it takes longer for the body to heal it because we're interrupting a natural process. Now, the same thing happens in the brain. The brain is able to heal us from traumatic experiences, from hurts, from disappointments, and all the negative thoughts and feelings that these experiences evoke. But we need to let the brain do its job on its own without interfering. Worrying and ruminating about these thoughts and pushing them away is going to interfere with this process. So someone who suffers from anxiety worries a lot. They worry about the future, their relationship, about worrying itself, about their health. But all this worrying that goes on constantly in the back of their minds is going to block the brain from taking care of all these what-if thoughts that pop up. So, in order to recover from anxiety, we need to leave these thoughts alone and not worry about them so the mind can take care of these thoughts on its own. Just like not scratching the wound would help the body to heal it on its own. So metacognitive therapy has recognized that overthinking in the form of worry and rumination, along with some other unhelpful coping strategies, maintains mental illness. So the goal is to reduce the amount of time people worry and ruminate so that they can recover and feel better. So that leads us to the mechanism of change. So what mechanisms change in the brain since we feel better if we reduce worry and rumination? You may have noticed that some people worry and ruminate a lot, and maybe that's you as well, while others just don't worry at all, don't ruminate at all. Maybe you have a spouse that never worries, maybe you have a colleague or a parent or a sibling or a friend. So the question is, what makes some people worry and ruminate while others are able to move on with life without doing that so much? And that leads us to metacognitive beliefs. So metacognitive beliefs are ideas, general ideas that we have about the way our thinking works. An example is that I cannot stop worrying. That's a metacognitive belief. Or worrying will help me be prepared for the future. These metacognitive beliefs activate our worrying and rumination and overthinking in general. So let's say someone has a thought, what if something bad happens? Or what if I panic later? If they have a metacognitive belief that worrying helps me be prepared for that situation, they are going to start worrying. But the more they do, the worse they're going to feel. So metacognitive therapy not only tries to reduce worrying, it also targets the metacognitive belief that is responsible for activating worrying in the first place. So the change mechanism is changing metacognitive beliefs. So we stop worrying and don't engage in worry as a strategy whenever negative thoughts and feelings come up in the mind. So does this explanation make sense to you? I'll let you be the judge of that. But if you want a tip, look back at your own experiences. Do you recognize that you worry a lot? Do you recognize that you overthink, that you analyze your thoughts a lot, that you ruminate a lot? Do you have beliefs about worrying being helpful or rumination helping you solve problems? So if you can recognize some of these things and all the other answers make sense to you, it gives you a better basis to decide. What is required of me if I start therapy? What is required of you is to follow the exercises and do the experiments in the session and outside of the session. One important part of metacognitive therapy is to help you have a relaxed relationship with your thoughts and your feelings. You're going to learn that negative thoughts are not dangerous or important just because they come up, and that feelings are brief and they disappear on their own. So, in order to gain that experience, talking about it is not enough. We also need to do some experiments so you can realize on yourself how this works for you. Let's say if you're struggling with low self-esteem and you beat yourself up a lot, you'll probably do that every time you're out amongst people, or you're doing an assignment, or you're watching TV. So it's important to apply what you learn in therapy in those situations to really understand and notice how this is, if this is helpful for you. There's a lot of research behind metacognitive therapy. Both the theory of what constitutes mental illness, the metacognitions, the overthinking, and the techniques that are developed in metacognitive therapy or for metacognitive therapy are each tested to see whether they treat what they promise to treat and whether they are effective. All of these techniques have proven to work in reducing worrying and rumination, and more importantly, challenge these metacognitive beliefs that we hold, so that the change that happens in metacognitive therapy is one that is sustainable and holds in the long term. There's been done a lot of research for how effective metacognitive therapy is for various illnesses. Especially when it comes to depression and anxiety, there's a huge evidence base that proves not only does metacognitive therapy treat these disorders effectively, it also performs better than, for example, cognitive behavioral therapy. A recent study comparing metacognitive therapy for depression versus cognitive behavioral therapy for depression found that 74% of the patients who received metacognitive therapy recovered and maintained their recovery in the long term, compared to 54% of those who received cognitive behavioral therapy. Now, this 50% improvement rate is very typical for cognitive behavioral therapy. The research behind metacognitive therapy consistently proves that the recovery rate for MCT is between 70 and 80%. This is a high number. One study tested the long-term effects of metacognitive therapy for generalized anxiety disorder compared to cognitive behavioral therapy. And that was done in a follow-up study 9 years after the treatment had ended. So again, the research proved that even 9 years after people receiving metacognitive therapy, they still maintain that level of recovery from their symptoms, which is good news. However, we still need to see more studies like this, just like we need to see bigger studies and studies with different populations to fully prove that metacognitive therapy is effective. In my experience, metacognitive therapy has so far been the most effective treatment that I've come across. Not only am I very convinced by the research behind it, but also the practical work with working with clients, working with groups, and even applying this to some of my own worries has proven to me that this is super effective. Now, we don't know what the future holds, and maybe something different may come by in a few years, but so far, and according to the evidence, metacognitive therapy is very effective and very promising. If you'd like to learn more about metacognitive therapy, go to the website metacognitivetherapycentral.com, where you can find a breakdown of the research. You can look at the different exercises. There you can also download a free ebook to help you get started with metacognitive therapy if you're suffering from mild to moderate worrying and rumination. So go there, check it out, see if this is something for you. And if you're considering starting therapy but is still not sure, you're more than welcome to book a free intro session. In that session, we'll look at your individual case. You can have all your questions answered, and we can create a specific plan that can help you find out how metacognitive therapy can help you and support you in your journey of becoming worry-free and rumination-free and have a better mental health.